Good evening, everyone, and welcome. Thank you for being here with us today. My name is Mark, and I will be leading this in-service today. So we are gathered here in meeting room number 2, just outside the emergency department at Campbelltown Hospital, where we all work together as registered nurses. So the issue that we're addressing here is called Closing the Gap, which is a national strategy that has been implemented by the Australian federal government. Now, the aim of the Closing the Gap campaign is to help minimise the disadvantages experienced by Indigenous Australians in relation to all aspects of health and living. Today, I will be specifically addressing the issue of hypertension and how we as an emergency department team can help to close the gap in relation to the large disparity that is seen when we compare the incidence of high blood pressure amongst Indigenous Australians as opposed to non-Indigenous Australians. So according to data from the Australian Bureau of Statistics, it was found that within the past half a dozen years in 2018 and 2019, Indigenous Australians experienced a higher rate of hypertension per capita than non-Indigenous Australians in every age group that was measured. The Australian Bureau of Statistics estimates that approximately 31% of the Indigenous Australian population were living with high blood pressure in 2018 and 2019, and this is compared to only 23% of non-Indigenous Australians living with hypertension in this same time period. This represents an 8% difference between both population sets, and hence why there is a need to work towards closing the gap on this issue. It should also be noted that the rate of hospitalizations for hypertension amongst Indigenous Australians has also been rising. Comparing the data sets in the years 2018 and 2019, there was an increase of 51% in hospitalizations for issues related to hypertension amongst Indigenous Australians when compared to the same data from nearly a decade prior in 2009 and 2010. Essentially, when comparing the numbers per capita, there were 43 more Indigenous Australians per 100,000 population presenting to hospitals in 2009 and 2010 compared to non-Indigenous Australians. Then in the period of 2018 to 2019, this same number rose from 43 to now 67 more Indigenous Australians per 100,000 head presenting to hospitals for hypertensive issues as opposed to non-Indigenous Australians. This elicits a clear widening of the gap in this aspect of health, and the growing disparity in numbers is an issue in which we are trying to address. We play a significant role as nurses in helping to not only treat the initial diagnosis of hypertension amongst Indigenous Australians, but it is also important that we try to educate each of our patients as to how they can help lead a healthier lifestyle in order to alleviate their risks of being hypertensive. As a nurse, we rely on communication skills in order to build a trustworthy rapport with each of our patients. Once we have identified that an Indigenous patient has a high blood pressure, it is our role and responsibility as registered nurses to converse with the patients about their lifestyle choices and the potential risk factors that could be contributing to their elevated levels of blood pressure. We should convey to our hypertensive Indigenous patients that present to the emergency department that the major risk factors for acquiring high blood pressure in both modifiable and non-modifiable risk factors. Some non-modifiable risk factors that the patient should be made aware of include their family history and their age. On the contrary, patients should also be informed that they do have some control in regards to controlling their blood pressure levels. Some non-modifiable risk factors that each patient should be educated on include modifying their diet in order to reduce their salt intake, as a particularly high salt intake can lead to hypertension. Patients should also be encouraged to reduce their alcohol consumption and to lead a healthier lifestyle by becoming more physically active and potentially trying to lose some of their body weight in obese patients, as these are all factors that can help to reduce the patient's risk of acquiring hypertension. It should also be noted that a person's arterial blood pressure will often fluctuate regardless of whether they are normotensive or hypertensive, and so if it is necessary that we recheck each patient's blood pressure when we suspect that they are hypertensive in order to gauge a more accurate reading of where their baseline levels truly sit at. There are numerous strategies that we can implement here within the emergency department in Campbelltown Hospital in order to address the issue of hypertension amongst Indigenous Australians and ultimately close this gap and bring it close to the non-Indigenous normal. We could mandate that on every occasion an Indigenous Australian presents to the emergency department and records a high blood pressure reading, we could automatically refer them to an Indigenous social worker who would focus on communicating to the patient some of the modifiable risk factors that they could potentially change within their own daily lives in order to reduce their risk of developing hypertension. By referring these patients to social workers who specialise in dealing with Indigenous people, I believe that these patients may be more receptive to the messages being relayed to them, as they would be coming from one of their own and someone who they would more likely trust. Another measure that we could put in place to create a clear set of guidelines in regards to how we go about measuring each patient's blood pressure in order to obtain a reliable blood pressure measurement. It is important to understand that there are numerous factors that can influence the reading. For example, the measurement should be taken at least 1 hour after the consumption of caffeine and at least 30 minutes after the patient's last smoke if they are a smoker. The measurement should also be taken when the patient is calm and without any cardiac stress. And it is also crucial that an appropriate cuff size is also used. The patient should be sitting upright in their bed or ideally in a chair if possible and with both feet flat on the floor for at least 5 minutes before taking the reading. The nurse could also take the blood pressure manually in order to get a more accurate reading. Thanks for watching.